Good evening, everyone. We are so excited to be back with you all again tonight as we kick off our series around Black maternal health with a focus on Northeast Louisiana. Dr. Jamil Norman and I are the collaborative team behind this effort. And the theme that we are working with this year is breaking the silence on Black maternal health in NELA, which is in alignment with the national theme. We are so thankful for the opportunity to collaborate with such amazing women to be a part of this panel tonight. We had an absolutely amazing time on Monday with some great doctors, mental health therapists, and other community advocates who were such a great voice in the conversation about breaking the silence in Black maternal health. We have gotten some amazing feedback from everyone about how much you enjoyed that conversation. So, Jamil and I are definitely feeling very excited about today as we are so honored to have some of the most phenomenal women that I have met in a long time. And I call them the Texas crew, as all of our women tonight live in Texas and have some type of connection to Louisiana. So we're very, very excited about this, and we look forward to continuing the conversation. I want to encourage you all to hit that share button at this time, please, so that we can let more people know about the conversation. Share it with your friends, encourage them to tune in tonight to participate in the conversation and to listen. We will not delay. We know that it's kind of late, and we want you to enjoy all of the conversation. I will kick off with the introductions, and I just finished the welcoming Dr. Jamil Norman was such an amazing host that she will continue that role on tonight. One of our first guests of the night is Miss Carolyn Jordan. Mrs. Carolyn Jordan has worked in hospital administration um, for about 20 years now.
Mhm.
Her expertise areas include understanding the dynamics of the hospital, understanding matters as it relates to HR and employee safety and rights. And she also has a background in the legal realm. So she has a lot of knowledge about it, as well as her personal journey around entering motherhood as a woman who was over 35 and learned a lot of
Mhm.
amazing lessons along the way. We're looking forward to hearing some of that journey. Our second guest is Christy Bordell. She may be very familiar to us if you were in the NELA community for the amazing work she did with the Children's Coalition here. She has transitioned to an amazing role out in Texas where she continues to do advocacy work on behalf of women, the LGBTQ plus community, and all underserved populations regarding rights, support, and safety. She has also done a lot of work around maternal advocacy in the state of Louisiana and has a long resume that spans more than 20 years of bringing knowledge, information, support, and empowerment to people. We're definitely looking forward to her knowledge tonight. Really excited to have Dr. Ramatu Kasimu online with us tonight. I was very fortunate to meet Dr. Ra about 4 years ago, I think it's been, when we were actually on the I've Been Waiting documentary together. She was the host for our segment, and I had the chance to learn some amazing things. We clicked very well that day instantly and have been in touch with each other ever since then. And so it's just been wonderful. In addition to being a classroom educator, she does some work called Dr. K's Health Minute, where she advocates for health and sexual wellness and even talks about maternity and just how we can live our best lives through health and wellness. She has a growing platform and continues to do a lot of community work, and we're looking forward to what she has to share tonight. Our next guest, who is not last, but certainly last to be introduced, Miss Tamika Christmas. So excited to have her on the panel tonight. We met by chance via social media after I saw some of the work that one of her good friends kept sharing and heard about the work she was doing with the Mama Wellness Foundation. At that time, she was still in Louisiana. She has since transitioned to Texas, where she has made some amazing strides from helping others access funding resources through grants and build their businesses to establishing a nonprofit organization that specifically works with the wellness of Black women as it relates to motherhood and maternity. So we have an amazing panel of women tonight, and I've done a little bit of an introduction, but I will step back and allow them to tell you just a little bit more about themselves. At this time, Mrs. Jordan.
Hello, everyone. My name is Carolyn Francesca Mays Jordan, and I currently reside in Texas. I am employed at a healthcare organization that employs over 400 physicians. I am the risk manager for this organization. I also have a background in medical malpractice and litigation. I am an ABA certified medical malpractice attorney, paralegal. I've worked very closely with attorneys. And so my entire role within the healthcare system currently is minimizing risk. And what that means for the organization is education for the physicians on how to improve, showing them and telling them opportunities for improvement, and making sure that we are running the best possible healthcare organization with safety practices in tow.
Awesome. Christy Bordell.
Good evening. I'm honored to be here today. I'm Christy Bardell, and I lead an organization currently that's committed to ensuring everyone has access to sexual and reproductive health services. While I'm currently in Texas for the last 4 months, my whole career has been working in the state of Louisiana and across the Gulf Coast. So I've had the opportunity to advance sexual and reproductive health work and work in the maternal and child health space in both the government sector and nonprofit sector. And it's really important to also highlight that I've had an opportunity to work in pretty much every system: healthcare, education, community, because it's so important to highlight that we don't live singular issue lives. And there's so many intersections in maternal health and maternal health outcomes. So I'm excited to join you all today and share more information.
Awesome. Thank you. Dr. Ramatu.
Hello, everyone. My name is Dr. Ramatu Hassan. I, as Jamie said, am a educator by day and public health consultant, public speaker, academic writing coach by night, and also sometimes during the day. Um, my business is kind of three-pronged, but as a platform, I provide easily accessible and digestible health bites, or AKA health minutes. Not gonna lie, I've been slacking a little bit on them since postpartum, but they're not as structured. It's more so like, oh, this is happening. Let me tell the people, because it's a lot of it's a lot of misinformation floating around right now, and I predict that that misinformation is going to increase. So I'm finding the energy to get to reposting these videos with some consistency. But my areas of expertise are Black maternal health and maternal and child health, more specifically, mental health, health inequities, and global health. And after realizing that while Black maternal health was an area of expertise for me, then I got pregnant and I was like, I actually don't know nothing about actual pregnancy. Because they was like, hey girl, have you done what? I need to do what? What do you mean? And similar to what Jamie was saying about our other guest, got pregnant at 34, delivered at 35. So of course that became they call it advanced maternal age now and not geriatric. I guess they're trying to like not hurt our feelings as much. But yeah, had a high risk pregnancy and then spiked preeclampsia. So I have spent time since then, like unveiling is what I call it, because I feel like a lot of stuff that goes on with pregnancy is kind of like one of those hush hush. And then, people be surprised when things happen to them. And it's like, then you tell somebody, oh yeah, I had that, it's fine. Well, you ain't tell nobody. Like, maybe I'd have been prepared. So that
Mhm.
has been one of my main focuses. So discussions like this are
Mhm.
my jam.
I love it. And last but not least, Miss Tamika Christmas.
Good evening, everyone. I am currently located in Texas as well. I transitioned from Louisiana about 2 years ago when I had first launched the nonprofit organization, the Mama Wellness Foundation. We focus on actually providing free or affordable mental health services for Black mothers during the postpartum period or beyond. Um, I started a nonprofit due to my own experience with postpartum depression, including a lot of the conversations online around postpartum depression, around the silence of depression in general, and the conversations just being very quiet about pregnancy and postpartum. So I really wanted to focus on that postpartum phase. So I work with organizations here in Texas to increase access for Black mothers.
Awesome, awesome. And with that being said, we'll turn the mic over to Dr. Jamil, who will be running the show tonight.
This is great. I love it. We have such a diverse panel. Just want to give you guys a little bit of my background as well. So I am a registered nurse. I have been a nurse for 24 years. And like I said the other night, I'm not sure how that happened because I'm only 25. So I started at a very young age. But I was a labor and delivery nurse and when I worked in the bedside, and love everything about women's health, and then transitioned and started as a nurse educator. And I've been educating nurses for, 18, 19 years now. And I just love everything about women's health and maternal child health care. Then transitioned as a nurse researcher. And actually this Texas crew, I did most of my nursing research with Texas A&M, with some colleagues from Texas A&M, looking at some counties that had some high maternal morbidity and mortality, and focused on some research with women before there were issues, just to see if we can get to the root cause of what is the issue? What are Black women saying about their maternal health care? And so that is, I'm an advocate, I'm a researcher. Like I said, I love everything about women's health and child health as well, because as we know, whenever you're dealing with pregnant women, you have two patients. So this has been my passion for a long time, and I'm excited that we are kicking off Black Maternal Health here in Northeast Louisiana. Jamie and I have been talking about this for a while, and I'm just excited that we have kicked it off, and we are, we're having these discussions. And so let's go ahead and start with our first question for the night. So, how can professionals be trained to better serve, improvements in Black maternal child healthcare outcomes? So what can we do to train our professionals?
So I would say it starts with professional development. So from my perspective, one of the things that I didn't say earlier is part of my job is patient advocacy. And so with that comes things like case reviews. And as much as I hate to say it, we don't review something until something has gone terribly wrong. But within those reviews, part of our job is to provide feedback to our physicians, our mid-levels, and it ranges from discussions regarding bedside manner. It's giving them just the gumption to actually come to receive the education. So there's sometimes we have to use incentives to get them there, but focusing on the root causes of what happened for a particular visit in terms of whether or not you were listening to your patient. So it really boils down from my perspective and what I do on a day-to-day, and it all stems from making sure that we are providing the education and that we are sharing those opportunities for improvement based on real and actual events.
I love that. Because that's the real thing, right? When you lose a patient, when things go wrong, to bring it back so we can dissect and figure out exactly where did it go wrong? How can we prevent this in the future? And so bringing everybody into that conversation and discussion, that's good. Anyone else want to chime in on that?
Well, I'd also add that it's important to look at what we call social determinants of health, where people live, learn, work, and play. As I mentioned before, people don't live singular issue lives. And it's really important for providers to come from an aspect of understanding those social factors. Research has shown that your zip code is more of an indication of your life expectancy than your genetic code. Your zip code matters more than your genetic code, which is very profound because that illustrates that your access to resources, access to fresh fruit and vegetables, whether or not you can actually, transportation, do you have the ability to go see a provider? Those are all factors that we need to consider when looking at and serving individuals. So that's one thing that I think is really important as we train up providers.
That's such an important thing to bring up there, Chrissy, right? Because sometimes I think that we treat patients just for that one thing and we're not looking at them holistically. And so let's say, you're telling them that they need to go out, they need to exercise, and you don't have to join a gym. You can just go out and walk. Well, what if they don't feel safe in their neighborhood to go out and walk? Then, all those constraints in how we're trying to provide care for them. Anyone else? All right. So how about partnerships? So a lot of you guys have organizations that you're a part of or that you created yourselves. What partnerships have you established with communities to advance Black maternal health and better outcomes? Or even just also telling us about your agenda.
I can go. I think what Christy said in terms of like thinking about all the social determinants of health, right? So with my nonprofit, while we focus on providing access for mental health services, we also have to think about like what's causing an individual to have mental health issues, right? And so we start developing partnerships with rental assistance companies because maybe a mom is struggling with financials and they need to be able to afford to stay in their house. And then we have partnerships with doula organizations. So maybe they just need a little bit more help around the house. And so then that can relieve some stress as well. So I just think like different partnerships that allow you to look at like what's the root cause of this person having a mental health issue, for even needing therapy at this point, like accessing all of the resources in their communities so that they can improve their mental health, not just through the therapy component, but through like, this is actually going to prevent me from having to go back to therapy. And now my issue is kind of like resolved. So just partnering with different organizations that support that social determinant.
I just wanted to share that I like what you said, Tamika, about partnering with organizations that focus on that social determinant, because what you didn't focus on is just saying maternal health. It's really about what various aspects are attached to that and what organizations can help you meet that need, as opposed to feeling like they have to be attached to the total issue. And I think that that's good because a lot of times I think when we look at certain things, I said that earlier, people are asking like, well, what can I do? How can I do it? I think what you're posing then is saying, how is what you do beneficial to Black maternal health? How can you find a way to connect your organization or your work with supporting the issues that are attached to Black maternal health? So I just wanted to share that.
And one thing I wanted to just lift up is that when we look at maternal health, we're looking at essentially across the life course before someone gets pregnant, while they're pregnant, after pregnancy, the family planning component. That's so important to highlight when it looks at who we're partnering with, who are those unlikely allies. I like to always say historically, in some of the work that I've done, I've had the pleasure of partnering with interfaith leaders, politicians, schools, because we really have to see that it's so important for a woman's health even before they decide to get pregnant as well. So ensuring that we're looking at stuff from that life course model when we're looking at partnerships to improve maternal health outcomes as well.
Excellent.
Right. I love that you brought that up, because that's actually the model that grounded my dissertation, where I was looking at women of color who were teenage mothers, but like weren't teenage mothers at the time that I did my study, and looking at their mental health status. And that was the main recommendation that I came up with, is that like we're letting go of women too early in postpartum. And so a lot of my partnering is with organizations that focus not just on the first 6 weeks postpartum, but like understand that, like, personally, I feel like you're in postpartum the whole rest of the time, right? As long as they're alive, like after you didn't have the child, all of that is postpartum. But going back to what you said, like, it is so important, and not just for like outcomes, but like for quality of life, to be partnering with organizations that are addressing those social determinants of health at every aspect and at every stage and at every role change.
That's such a great, you bring up such a valid point, right? Because a lot of the resources for women after birth is for 6 weeks. And all of us who've had children realize that is, it just is getting started after those 6 weeks. And even for a woman, for your body to regulate and go back to what it was prior takes over a year. And 6 weeks is just, it doesn't cut it. And so I think that's really a valid point to make sure that women have resources for longer than that period. When you think about like mothers who are breastfeeding, you run into issues that you may not have had right in those first few weeks. And now your milk's come or it hasn't, you're having issues, how long can you actually access the lactation consultant? All those different resources that we want to make sure that women have at their disposal for longer periods. And so collaborating with others in the community to make sure that everybody has exactly what they need is such a vital, component. Anything else on that? All right.
I want to just share this. I want to share this comment because I think it fits in. She, Miss Audrey says, "What about women who experience depression while pregnant? During both of my pregnancies, I never felt truly happy, but after delivering, all of the joy and love was there. Now I still feel weird discussing my pregnancy because it wasn't an overly joyous experience." Did anybody have any feedback around that part? People who experience that depression during the pregnancy.
Because we always talk about postpartum depression, right?
Yeah.
But there's a lot of, your body changes, your hormones are fluctuating, all the things that can happen during pregnancy. So then you're thinking, oh my gosh, am I really crazy because I'm pregnant and I'm not happy? Like what's wrong with me? Because depression can happen during pregnancy as well. Even if it's, if it's planned and you've been wanting this child and all, if everything is still what you thought was perfectly aligned, to still be depressed we don't really talk about that. But depression can happen anytime. And so making sure that, our patients, as me, as the nurse, thinking our patients have those resources during their pregnancy as well. Tamika, you want to add anything on that since you are our wellness expert as well on this panel?
I focus a lot on the postpartum depression, but I've come across a lot of women that are getting service at the Mama Wellness Foundation about depression during pregnancy, but it's not talked about a lot, right? We expect women to be happy that they're having a baby, right? And then sometimes we'll say like, oh, there's other people that can't have a baby. And so that makes them feel like their experience is not worth sharing, right? And so I think it just needs more conversation around the depression during pregnancy, and that I think we're starting to talk a lot about that, but definitely that silence, right? People are pushing people to be silent about their experience, and so then they feel very weird about sharing it, right? So I think that's the part is just silencing everyone, and so we need to really just push more conversations around it.
That part you said about, when somebody expresses how they're feeling and folks react like, well, there are some people who can't. That happens so much. And just because a person is expressing that they are not feeling like themselves does not mean that they are not happy to have life growing. You don't always control the way that your hormones show up, or even just the way that your brain is working or your body is feeling during that season. So I think what you said is so important, about us changing how we respond to people when they indicate that they are not feeling like themselves when they are pregnant.
Yeah, I was just going to also add that there's just a lot of stigma around mental health overall. Recently, I was reading something that mentioned Black women are twice as likely to report suicidal ideation in the postpartum period. And as Jamie mentioned, a lot of times when you may express, hey, you know what, I'm feeling down, I'm not feeling good, people may just brush you off. But how can we train people, lay people, to really respond to individuals when they are calling out for help and support? There's services and resources that can train lay people. So how can we get that more in our community to be like, hey, you know what? I can I can connect you with someone. I know of a free resource. I know of a free service, and start breaking down that stigma. I think that's going to be essential.
And I want to express that Christy is the queen of connecting a resource. So I'm sure she has already learned 95% of Texas resources already.
Well, and I was going to say, even platforms like this, right, where we are talking and we are encouraging you all to speak up. We are encouraging you all. It's okay to advocate for yourself. I always talk to Jamie about my pregnancy journeys. I had my second child at 40. And for me, I had several miscarriages prior to getting pregnant with her. And I was terrified the entire first trimester. So depression looks differently. Sometimes it's stress and strain that you're placing on yourself because you're wondering, am I even going to have a baby at the end of this journey? Each week you're stressing as to, what's going to happen. Is the doctor going to tell me something different? Sometimes those stressors and that depression stems from finances. Can I afford this baby at the end of this journey? Excuse me, especially if you have children already, you know how expensive they can be. And the misconception is that, oh, we feel like this, so it's just wrong to feel this way, right? Or we shouldn't have these thoughts. We should just be happy. Someone mentioned that earlier. At least you can get pregnant. So I think for me, and what I would encourage everyone to do is really utilize the resources that you do have. If you have a nurse that's a friend, if you have a PCP that you like, that you can ask, hey, I'm feeling a little off. Do you have any recommendations? Is there someone that I can talk to? Do you have some literature? Because that's where it's going to start, because only you can determine how you feel. And so for me, it was a really, 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 really tough journey. I can remember people saying, "Are you even happy that you're pregnant?" And it was depression mixed in with a lot of fear as to whether or not I could even carry my baby to term. So I just wanted to say that because sometimes we think, or it is a perceived notion that depression is supposed to look one way. And it really does come in many different facets.
Mm-hmm.
This is so good because, like I said, we've already gone into the next question, which was, you know, what are the unique mental health challenges Black mothers face during pregnancy and postpartum? And I think that we've hit on a lot of them.
Mm-hmm.
And I wanted to share, when I was doing my qualitative research in Texas, one of the main themes that came out was fear, right? And so it was also fear for women who were carrying sons because of, the climate of, raising a Black son in the United States. And just the fear of when this child grows up, will they be protected? Will they be killed? All of those things. Women were already thinking about that when their baby was forming in their uterus. They were already fearful about that. Other things that came up were women were scared that they were going to die during pregnancy because of all of the things that are going on with Black maternal health, right? We're finally talking about it. We know the statistics, and they were just fearful that they weren't going to make it with their pregnancy. It wasn't even a high-risk pregnancy. They were all very normal pregnancies, but we know that Black women who have normal pregnancies are dying. And so those stressors actually, make it even harder on the woman during pregnancy. So in my research, that was, we were looking at allostatic load and what that does for a woman during pregnancy. And so there's so many challenges that I think stem from that mental health component for Black mothers that are different than other mothers during pregnancy and postpartum. Yeah.
And you also have health issues that are more prone to African American or Black women. I'm sure everyone on this call knows someone that has had preeclampsia. Okay. I had preeclampsia with my first one, and it was awful. She was 3 weeks early. And I had an extended stay in the hospital. And with my second child, I had postpartum preeclampsia. So I was discharged home, and 3 days later, I was back in the ED.
I remember that.
And yeah, you remember, and was in the hospital for 2 weeks after that. And I think it's important that we have these discussions because a lot of us do not know what that looks like until we've gone through it. And then, as someone mentioned earlier, it's like, well, why nobody didn't tell me that it was going to be all the things? So again, I think that having these discussions so that people will know what it looks like, know what questions to ask. What's the likelihood of this happening to me? What can I look for? Can I be prepared for it? Because sometimes you can't, unfortunately. It comes out of nowhere. But at least you know that it's a possibility and it exists, and you can potentially try to put some things in place so that you can prepare for it. Because that is huge, and it's more in our community than any other communities.
Yeah.
Jimmy, go ahead.
I would also like to say, that there are things also that affect not just physically, but going back to the mental health part of the question. I think that for Black women, there is a higher level of internal and external stigma. And in that we have been presented very specific images of what mental health issues or problems look like. And so then when they don't look like that for you, but something's off, you're just like, well, I'm having a bad day. Or I'm, why do I feel like this? I shouldn't feel like this. Going back to what Tamika was saying about like, when they're like, well, why aren't you happy? Well, there's that guilt of like, okay, well, I should be happy.
Mm-hmm.
And then there's also like, this is what I wanted. So why is the brain not doing what I wanted to do?
Mhm.
And then there's also like being able to educate and like inform on the fact that like it's going to look different. It's going to look different in different people. Additionally, a lot of people also automatically think, oh, it's postpartum um, depression, but there's postpartum rage, there's
Mhm.
postpartum anxiety. Prime example, I had postpartum anxiety, and it took almost, my daughter was like 10 months old before I could name it. I didn't understand exactly what it was. Like, I felt like I was doing too much and doing not enough at the same time. And then it also like would feel like everything was on fire. But I was like, oh, but I thought, oh, this is
Normal.
regular. This is regular. This is regular. And it wasn't until like 10 months where I was like, um, I don't think. But I feel like for a lot of Black women,
Mm-hmm.
we assume, because again, we're not sharing stories, we assume that mental health issues are, we minimize them. And that's
Historically.
one of the things, right? Historically, that's what I loved about strong Black woman is killing us.
Exactly. Yes. Yeah. Because mom and grandma may have went through the same things, but we don't talk about those things, right? You keep that in the family, make sure you got to get up, take care of yourself, take care of your kids, get out that bed, do all the things, because mental health, it's like we don't have those issues. We don't have breakdowns. Get yourself together. And so I think like the more that we discuss it, especially in the Black community, the better it's going to be, because 10 months, just thinking that was a long time for you to be feeling that way and not being able to talk to anybody, to get any help, because postpartum psychosis and that's very, very real. And we've got to break down those walls to where we are talking about it openly, and we don't make women feel crazy. That it's something that women go through, and that we can give you help, we can provide you with resources.
Jamil, I just want to. Oh, go ahead, Tamika.
I was going to add to that because I remember my mom, maybe a year after postpartum, she was like, "You're so angry. You were so like, you always like was snappy at people." And I think if like she had the language and the education around like what I was feeling, or even me, because I planned for pregnancy, but I really didn't plan for like that postpartum experience. I think she could have like got me help sooner. Right. And so it could have kind of not push into postpartum depression, but it could have helped me kind of get that language early. But I think it became normal for her, right? So maybe she've experienced that in the past, and it's just been like, oh, we just take care of our kids, we move on, And so that language and education for our support community as well is needed. They need to know like what they're seeing in their friends and families as well.
So I think that what you all are saying definitely connects right back to what Christy was talking about in terms of how are we informing people and training people to be aware, and especially within our community, really changing the dynamics of it, because the strong Black woman trope, which we talked about in the documentary, goes back into our history. Um, being forced to present this image in order to survive. And so breaking the stigma of something that has been attached to us generationally, literally for hundreds of years. Honestly, no matter where Black women come from in this world, it's attached, because most of us stem from the same continent, and in many cases we're spread around this continent in a particular way for a particular reason. So we end up with a lot of the same conditionings. And so as a result, it's gonna take work to break that. But that component that Christy was addressing a moment ago about how we training people, how we making those resources known, that's what's the most vital part about how we change the direction on it. And like Tamika said, people notice it but don't really know how to deal with it, don't know what language needs to be used to help you get from one place to the other. Jamil, I just also wanted to say you said something that I think is very, very important. And that I feel I can relate to when you talked about Black women carrying sons.
Mhm.
And when I had my son, I remember that as I got closer to my delivery date, I did not want to deliver Lee. I literally cried and just told God, I wish I could just keep him in my stomach.
Because you
I
keep it
did not
safe.
want to deliver him. I was just so anxious about all the scenarios and even my experiences as a Black woman and knowing it would be even more challenging for my son. I just didn't want to bring him. I just, I was like, if I could just keep him here, I could always protect him. And the closer I got, the more I cried about having to birth him into this world. And I think that in the place that we are right now is also going to be very imperative that we check in on women and allow them to feel the way that they do, because we are unfortunately seeing the rise of some very, very challenging times that are not only returning but are growing. And so I wanted to lean into that for just a minute, because I think that where we are now, it's important that we listen to that with very open ears, because I don't think that's something we talk about very often. I've actually never heard anybody else feel that way. I thought I was just weird until you brought it up tonight.
Hmm. That was a huge theme that I found. I was like, wow, um, for women to be feeling this before they even birth their son. It was very eye opening, very eye opening. So we've been talking about mental health and just what it really is for Black mothers. So when we think about resources, do we have any resources, or do resources exist that are culturally responsive, right? So that they're focused on Black mental health that we could provide for mothers, because there are things that we're talking about that I feel are more significant and in the Black community. What kind of resources are really those culturally responsive resources that exist? And if there aren't, I mean, if we are having a hard time thinking about those, like, first of all, maybe we need to create them ourselves. Sidebar, we can do that another night. But what, because we really have to make sure that we're giving our women the appropriate resources. Because if we're saying that we're looking at mental health and it says it's supposed to look this way, but for our community it doesn't, we need to shine the light on that to make them realize that this is what our experiences are, and these are some of the resources that would help our community.
Can I
Right?
pose another question that's attached to that, Jamil?
Definitely.
In consideration of where we are right now,
Mm-hmm.
how do we still um, support the specific needs of Black women
Yes.
while adjusting to the changes that affect our day-to-day living? I know outside of that, independently, we get to choose to do what we want, but within the spaces that we have to function each day, if that makes sense,
Mm-hmm.
how do we ensure, or how do we build around the specific needs of Black women, um, but not without um, really jeopardizing the positions that we hold? So
Mm-hmm.
how do we still cultivate that need for um a different sort of support and approach in light of what we know are real data, what we know are actual stories, what we know is the reality of the community's challenges for Black women with maternal health?
There's three resources I would like to lift up, but before I do that, I did want to share that no Black woman is immune to this. Research has shown that you can have the highest educational attainment, you can be wealthy, you're still more at risk than anyone else. So I want to lift that up because sometimes I feel like people think they're immune to this conversation because they may be wealthy or they have resources at hand that they feel that can support them. And then the second is the three resources I want to lift up. One being Sister Midwife Productions, which is based in New Orleans, who actually has a Black doula directory. And it's so important to highlight doulas because those are usually lay individuals that's training and supporting other individuals. And we know that when you receive critical information or any bad information, your comprehension, your ability to understand it decreases. So I just want to highlight even more important doulas, but also someone to support you throughout this journey. The second one is Shades of Blue, which is based in Texas, but I saw that they do online support groups. And these online support groups are for teen moms specific, individuals in postpartum, people who have experienced the loss in pregnancy, because a lot of times we forget that population as well. They have lost a child that they may have wanted, they long for, and it's like, where is that support to help them? And then lastly, Black Mama Matters as well. Those are the three that I lift up to really highlight and say those are resources around Black maternal health and Black maternal mental health as well.
I love Black Mama Matters. I follow
Me
them
too. Yeah.
And what was that first one you said, Christy? Because we want to definitely share them on our page.
Sister Midwife Productions. An important thing about them is that that doula directory, they've done doula trainings in Northeast Louisiana as well. So they've had an emphasis on trying to get doulas in more rural communities. And we know that rural communities are at greater risk for a lot of this as well. Yeah. Like some people don't know, mothers in rural communities are less likely to breastfeed. They may not have those resources. So shining a light not only on Black maternal health, but Black maternal health encapsulated within rural communities as well.
Very, very.
Like kind of what I heard you saying through the answer that you gave with that list of resources is listening to the specific needs of women and connecting them with people who meet their needs. Mm-hmm. That is actually listening to every person. And then actually figuring, because I think that's been one of the challenges in the past is that people tend to just blanket whatever. But there is a different set of challenges that Black women face. We see it in the numbers. We see it in the stories. Like it's just, there's nothing that we can deny about it. But actually for a change, listening to what people are saying and connecting them with a direct resource that relates to that is what will actually make the difference. Am I wrong in how I interpret that, or am I spot on?
No, you're definitely spot on, because when you think about it, whenever any of us try to access health services, the more barriers we have, the less likely we are to continue along that process. If you're trying to go seek counseling and you're calling up a provider, they don't accept your insurance, that's going to decrease your likelihood to continue to try to seek that support and services as well. So making sure that we have tailored resources and we really vet the organizations to ensure that they're reaching specific populations as well.
I love that. Yeah. Or even whenever those organizations that do serve, it takes you months and months to be able to get in because there's not enough, right? Mm-hmm. We can see that we need more, and then you try to get in a 6-month wait. And you're like, I'm actually having a mental health breakdown right now. And I need to see somebody now. And so that makes it even more difficult. So yeah, this is good. So, we've been talking about our community organizations, but, when we think about like policymakers and healthcare providers, how we can actually collaborate to drive that change, because, we can do our small things, which also affect change. But if we want change to happen on a larger level, we know that we need policies in place. And I mean, we're really seeing a lot happening right now that is pulling back a lot of the things that we have been doing over the years. And so, what do you guys think about how to collaborate to actually affect that change?
Well, and this kind of goes along with what Christy was saying. Um, it's gonna have to evolve into like some communal care, kind of, and it also kind of like goes back to Jamie's question of like, how do we move in this climate? It's gonna have to go back to communal care. I That's why like discussions like this are so important. That's why again, as Jamie said, we met 4 years ago. Up until that, like she walked in the dressing room, I was like, "Hey girl, I'm finna be interviewing, I'm finna get out of your business." And ever since then, like we've been keeping up with each other. Like I've interviewed her for other things, she's interviewed me for things. So it's like creating these like networks, creating these, like she was one of the first person I told when I got pregnant, because I was like, girl, I don't know how this happened, but right, I'm so excited. Oh my God. Because we commiserated on both of us having fibroids. And I was like, girl, well, you told me you was pregnant with one. So, I knew there was hope, but I didn't think it was for me. But the community, we have, it's so important, particularly like, because as a system, we're seeing a reboot. And in that reboot, we're going to need to be communal. We're going to need the whole like individualism that has been pressed upon us. We gotta reject it. Yeah. We gotta reject it. There's no other way. Like I said, when I found out I was pregnant and I told Jamie this, I took like 6 tests because I was like, this ain't no way. But my immediate reaction was to reach out to my community. Mm-hmm. Because now again, there was the fear of like, am I gonna keep this baby, or is am I gonna lose it? Is this? So I did do the whole, wait until second trimester. I told Jamie before that, but but again, that's because I was in shock. Yeah. But she also, because of our conversations before, like I knew what to expect a little bit, and that's so important. I also knew words to say in my what do you call it? In my visits. Because I'm the first to admit that sometimes I do suffer from white coat syndrome, where I'll just be, even though I know better. And I tell other people, hey, this is what you need to do. Sometimes when you coming at me like, yes, girl, this, and this, okay, ma'am. Mm-hmm. Yeah, you said I can't. Okay. You said, all right. Yes, ma'am. So having these discussions, having like organizations like Tamika's organization, having people in spaces where our faces will be seen, and being able to actually listen to people's needs and then direct them to the care that they need is going to be so important.
Yeah. And I think, also supporting our organizations, right? So that we don't have to rely on federal funding, because right now, organizations that are relying completely and solely on federal funding, we're going to see that they're gone. And I think a lot of those organizations were serving our community. And so, getting behind those organizations, not only in support, but financial support as well right now in this climate, is going to be really, really important.
And then as you reflect, when you think about it, through some of our biggest disasters, community is what got us through. When you look at COVID, when you think of any natural disaster, when I think of Katrina, it was community and networks that got us through.
Yeah. So one of the things I shared a few months ago, I think, especially when we were doing the healing circles, right after November, we did a series of healing circles, and I said we're going to have to lean inward for a change.
Mm-hmm.
For a while, we've been able to pull back, but we must lean in to each other. We must interlock. We must connect with each other and depend on each other through this process. And I think also, in a sense, uh, there will be some rebranding
Mm-hmm.
around how we sell the importance of who we are to the places where we work, spend, and exist.
Mm-hmm.
And so, from a community standpoint, how do we go into that space and remarket it? I was talking to one of my mentees the other day just about the dynamics around business. And so, when you take out some of the dynamics you used to be able to approach around diversity work, how then do you still reshape that message and market it under the guise of understanding the relevance of the people who work for these entities, who are part of these communities? Like, how do you sell it directly under the importance of that person, the quality they bring, the work they are, and how do these things thrive without them? So even when we talk about Black maternal care, right, because the mortality rate is so high, why is it necessary then for other people to be concerned about that, when we know that Black women are the fastest growing group of entrepreneurs, Black women are the highest educated sector? We know all these things about Black women that we bring that are valuable to any space that is actually not contingent upon our skin color.
Mm-hmm.
And so then how do we lean into those aspects and use those to drive the missions forward? And ensuring that the whole wellness of a Black woman from birth till, death is important to people, because as a woman, as an employee, as a citizen, we are important to the operation, the existence of all things. Does that make sense?
It does completely.
It seems like webinar 2.0, the business case on Black maternal health.
I love it.
We're here for it, Jamie.
Yes. Yes. It's so multifaceted, right? When you think about it, it's so layered. Yeah, that's good. So our last question for the evening, we've been talking about community, we've been talking about mental health, resources, but what can Black mothers do to advocate for themselves and their children, right? Because we want to give them all the resources, but when it's just them and their provider, or them and their child, like, how do we make sure that they are equipped to advocate for themselves?
I always tell everybody, one, documentation is forever. So if you feel like your concerns are not being heard, tell them, put it in the chart, and watch the demeanor, everything change.
Mm-hmm.
Tell them to put in say, okay, I would like you to document in the chart that I asked for such and such, or I showed concern about such and such, and you said such and such. Because charts are forever. So then if later on something happens to me, it's in this chart that I expressed this to you.
Mm-hmm.
And I said this to a woman one time, and she was like, it sounds like bullying. Baby, if you got to bully somebody to do their job, do it. Do it.
Well, I didn't know do it was coming behind that.
You work for me. You work for me. Do it. And also, and I know that this is a luxury that not everybody has, but I am a firm believer. And if you feel like you are not being heard, move around.
Yes. Yes. Because there are other choices, right? I love that.
I wanted to also ask Carolyn a question if nobody else wanted to speak to that piece. Carolyn, I just kind of wanted to, and I can pose this because it's my cousin and we talk all the time, but I really wanted, so one thing in particular that I talked to you about when I asked you to be on this panel is women who decide to have a baby later in life.
Mm-hmm.
And especially for Black women, the stigma that is put on us. I'm 42, and so I'm talking very transparent because we launched this. But I have conversations with my cousin all the time, and I think I've even
Mm-hmm.
told Christy before that my window for having a baby is still open because I have no beef with having a geriatric little one. Okay, me and my little senior citizen baby, if that's what God says it is what it is, because I believe that certain things just happen at certain times in different people's lives.
Mm-hmm.
So it is what it is. It happened in the Bible, and that's just the way life goes. But there are a lot of people, even whenever I make that statement to people, if I was not secure in myself, it would really impact me because of the looks I get, because of the things that people say to women who are older and are open to having children.
Mm-hmm.
What would you say, Carolyn, to women who feel stigmatized, who have also gone through pregnancy loss before, just based on your experience and even just the conversation we had about, you know, how you were able to handle, even after having miscarriages, still having the courage to say, I really want this and I'm going to trust God through this journey. What would you say for women who have been there, for women who are still hoping to have children and they feel like the outside world views them from a different way?
Ooh, that's a loaded question. Put me on the spot. Um, I would honestly, um, healthcare really has come a long way. And we've talked a lot tonight about utilizing resources. Some good resources was talked about on this call. Everybody has shared their experiences, but healthcare really has come a long way. So in my mind, there's no such thing as being too old to have a baby if you know what questions to ask, what specialists you need in your corner, um, and not afraid to ask the questions if you don't know. That's what's key. I do realize that I have access to a lot that people do not have access to, and I'm not talking financial. I'm talking about people that I know, physicians that I work with. So I do realize that that part of it is not fair, and everybody does not have that. But I also have a mouthpiece and I will talk and I will advocate for myself and I will ask questions. And so the first thing for me was finding a physician, finding an OB-GYN that listened to me. For a lot of us, that means I need a Black doctor, right? But the reality of it is access to a Black physician and actually finding one is it's difficult. So then the next question becomes, well, who can I get? And are they listening to what it is that I want to accomplish? So, what you didn't mention, Jamie, is that my first baby is a fertility specialist baby. That pregnancy did not come easy for me. And we don't have time to dive into that story, but it was a lot of research involved with finding the right fertility specialist for me with my first daughter. But I mentioned earlier that I had my second daughter at 40. And when I first started searching for OB-GYNs, I didn't have a good one initially. The clinic felt rushed. I felt like no one was listening to me. The doctor was in there for 2 seconds, and I was excited to be pregnant and wanted to ask all these questions. I had them written down. And I didn't even get to question number 3. She was ready to leave out of there. So I was devastated. And I, went home and I had a whole moment. And I said, you know what? It's okay. I'm going to find somebody else. So I started to ask questions because I didn't want to go through the same thing again. So I asked around, I asked friends, I asked coworkers, who do you recommend? And I ended up getting a good recommendation, and I now see the same OB-GYN, and I've been seeing her now for almost 8 years. So that was the first thing. And I think we have to be okay with changing. You know, it was said to you guys less than 30 minutes ago, if it don't feel right, get out, find somebody else. It is okay to do that. And I think you have to be comfortable in that. So my OB-GYN was great. But then what comes next is having a good maternal fetal health specialist. So, do you have good maternal fetal care? Once you get to a certain point and you're having a baby and you're a little bit older, then you have to figure out what that specialist looks like. And again, ask the questions, advocate for yourself so that you could get a good physician with that. And then honestly, there's still going to be things that are unforeseen. You know, Jamie, you and I talk about that all the time. Overall, I think my pregnancy was smooth, but when you are a certain age, the fun part is you get more ultrasounds, you get more photos of your baby because they are worried to death that baby is not going to be okay. But you can take that and look at it as a luxury that a lot of young mothers don't have, because you're in there weekly and you're doing all the things to ensure that baby is as healthy as possible. But then when you get to the end of the road, and I had a good monitor system when I was pregnant with my second. So in order to prevent preeclampsia, since I had it with my first, I was on a daily aspirin. And, we had all of these things set up. And I was like, this is great. My pregnancy's going great. This delivery is going to be great. I had a planned C-section, like clockwork. I went in, it was smooth. Baby came out and I was like, woohoo, went home. And then boom, was hit with that postpartum preeclampsia that no one told me existed. But I'm saying all that to say the common denominator in this conversation is I encourage everyone to speak up for yourself, ask questions. If it does not feel right, it's probably not right. And there are many people that you can ask questions to get the right physicians on your team. And it truly is a team effort for you to bring a baby into the world. Especially when you are a little bit older. And I hope I answered the question, Jamie, but it's a lot. And a lot was talked about on this call. We've talked about access. We've talked about resources. And one of the things that I wanted to say earlier when Jamil, you were asking about, well, what can we do? How can we change the policies? How can we have something more on the political front? And honestly, it starts with people like us that's on this call that actually have the connections to be able to tell people that what we're seeing is not right. What we're seeing is disproportion. What we're seeing is a hot mess. And then holding them accountable for the change. I mentioned earlier that I work with over 400 physicians, and I don't even want to tell y'all how many of them are Black, and I don't want to even tell y'all. We have 2 Black OB-GYNs.
Out of 400 people.
Now, are there other ethnicities? Of course. But if you are specifically looking for a Black OB-GYN, I don't want you to get discouraged. They are out there. But I don't want you to get discouraged if you don't have access to who you really want. Your goal should be getting someone good that's going to listen to you.
Yes. Key.
That should be the goal.
Yes.
And if they're not doing that, it is not the physician for you, because there is no way that you should not be able to have a successful pregnancy. It is too many resources out here. It is too many innovative things that has happened over the past 20 years that I've been in this field, and you will be okay. But it has to be the right team. It has to be someone that cares for you. Christy said it best earlier, and now I'm taking over, Jamie, but Christy said it best earlier when she said, she didn't say this, I'm putting words in her mouth, but people see Black first, okay? So it does not matter what your bank account looks like. It does not matter who you're connected with. If you show up to the ED in the baseball cap and a raggedy t-shirt, there is a misconception, there is a bias, there is a perceived notion as to who you are when you show up in there. And the treatment that you get is unbelievable. And it has happened to me. JB knows those stories. I had one of my kiddos stop breathing one night, and I had to rush her to the ED. And the treatment that we got, literally, the baby was unconscious and the girl was at the counter doing whatever. I start banging on that glass like a psycho. I mean, bam, 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 till someone came running out of the back. But literally, they didn't know who I worked for. When they found out who I worked for, then everybody was hot.
Everything hoppy hop.
Everything's different. But again, people don't have the same connections that we have on this call. People don't have the same ability. They don't have the same knowledge. And so I really do appreciate the opportunity to just be on here tonight, to just be able to tell people our journeys, our stories, encourage them to speak up, provide them with knowledge, hopefully give them some good resources that they can start looking up on their own to understand what it is that they deserve when they walk into that ED, what it is that you deserve when you meet that OB-GYN for the first time, because nobody's going to advocate for you the way that you advocate for you. Nobody's going to advocate for your children the way that you advocate for your children.
Absolutely.
Excellent. Thank you so much for sharing that. I mean, that was just really eye-opening and just moving. So we really appreciate you sharing your experience. And so do we have anyone else that wants to give any closing remarks? Anyone else that want to share anything else that was kind of on your mind? You know, the other thing the other theme that came out in my research was the not being heard.
Mm-hmm.
And we've said it so many times throughout the night. And I think that all, you know, that is the component of racism in healthcare, that, you know, we express it. We're saying something is wrong and we're not being heard. We say it, but we're not being heard.
I always tell people as well that you have to have the mindset that, yes, you are the expert on the medical. You are like someone, you went to school for this. But see, I've been in this body for 37 years. So I am the expert here.
On you, yes.
Because like I said, I didn't develop preeclampsia over time. I literally spiked preeclampsia one day, and my blood pressure went from like within a matter of hours. It was up to 235 over 156. And so, you know, obviously we got to deliver. And then I had the extended stay because they couldn't get my blood pressure down. And they finally got like a cocktail. And I tried to tell them, I was like, if you let me go home, it's going to go down. Now, of course, they was like, girl, shut up. Because it was still like 190, which, you know, thinking back on it, okay, maybe. But also, again, I am the expert in this body. And so when they finally got it down, they were like, we needed to be under 150 for 24 hours before we can release you. I was in the hospital 5 days. Meanwhile, my daughter passing every milestone, every test, you know, and I'm just like, I know, baby, I know we should go home, but it's me. And they told me to keep taking the cocktail of blood pressure medication until 6 weeks. Home 2 weeks. And I blacked out in the shower because, as I said, if you let me go home, my blood pressure is going to drop. I was still taking the medication. It had dropped my blood pressure to 65 over 35. And when I called the doctor, this was not my normal doctor. I called the doctor to say, hey, you know, to explain what happened. And she was like, well, you still need to keep taking it. And I was like, I feel like you didn't hear I had to call my mama. My mom was in the living room with my daughter, booty butt naked. I had to call my mama because I was passing out in the shower. And she was like, well, I'm going to notate in your chart that you're being non-compliant. And I said, okay, do it. If that's what it takes. Because again, like I said, we go to medical experts, and I'm not saying that you shouldn't trust the science. I'm not saying that. But what I'm also saying is that
They need to listen to
You
us.
they need to listen to you, because at the same time, if I'm telling you this isn't normal for me, or this is normal for me, or you know, this is my body, listen. And I'm not saying that like I'm saying this is my body in a I'm just ignoring medical advice. But if I'm also telling you that this is happening because I'm taking your medical advice, hear me. And you again have to walk into these interactions with like, yes, you're an advisor. Yes, you are an expert. But again, I am the expert in this. So let's work together. Or like I said, I'm gonna find me somebody else.
Mm-hmm.
I just wanted to add, as I'm sitting and I'm reflecting, advocacy is key, and yet so many people don't know how to do that.
Mhm.
It's like you're put in when you think about how you're brought up, and you're questioning authority essentially, and how can we begin to break that down is very complex. I don't have a silver bullet for it, but when you advocate, you have to have a sense of internal self-worth too. Like, you know your worth, and nobody can take that away from you. And that's like a deep dive conversation, because advocacy is so hard.
Mm-hmm.
And yet it is something that we have to do, and we have to learn to do on a daily basis, regardless of what system you're entering into.
Mhm.
The healthcare system is the one we're talking about today. But when you think about education, when you
Yes.
think of the justice
Come
system,
on.
Yes. Yes.
so I'll just say that's like a whole nother topic for a whole nother day. But how do we teach people to advocate for themselves and know and be comfortable, as Carolyn mentioned, to walk away?
Mm-hmm.
Pastor
Because the whole
Christy.
thing is you have to, and I love how you're saying it, this. We're talking about healthcare, but education, justice, all that. It has to be collaborative, right? I don't want a doctor who's going to just tell me. No, I want us to have a discussion on, okay, yes, I respect that you are the healthcare provider, you have knowledge, and you went to medical school. I will always respect that, right? But like Dr. Ross said, I know me, I know my body. And so if we work together, then that's going to, elicit the best outcome. But if you're just only coming at me and telling me, and not listening to me, and we can't work, for a positive outcome together, then it's not right. That's why you want a healthcare provider like that. I love that. We want, teachers like that. We all of that. So yeah, that's great.
And I think our role is like, we can begin to model that behavior. Think about it. When you go to the doctor and you have a child who is, let's say they're 10, 11, what is their role when y'all are going to the provider together? Do they have a chance to speak? Do they speak about their symptoms? How can you begin to train them up where they know that their voice matters? So I say that advocacy is hard, but also that we have so many opportunities to model that for our children and for anyone we're trying to bring up in today's society.
Pastor Christy, because that's what I'm calling you, because you just took us to church, okay? The piece that you are stating about teaching our kids to be advocates and to speak up, that's a community conversation. It goes directly into education. And so many of the things that I grow frustrated with, and Fran will tell you, and Christy probably even knows, my beliefs in teaching kids how to be able to communicate, not demeaning or belittling kids who can speak well. And who can communicate well. But because we also have a system attached to it where people are not evolving into better humans that are receiving our kids' ability to communicate in the right way, the mission is then to break the spirit and to humble them, and the effects of that are far-reaching. Emotionally, it's damaging. It is medically damaging because they stop being advocate for themselves. They don't speak up for their health. They stop being able to cognitively comprehend things on a higher level. Okay, there's such a big conversation that's attached to so much. But especially when we start talking about our traditional Southern settings and the belief systems that are attached to us, and how we see everything else attached to that crumble because we are not changing a lot of our cultural norms that have to do with how we rear children.
Mm-hmm.
So, and I know that would seem like a small piece, but it's big because it ties into what you're talking about in regards to self-advocacy and advocating for others. It's
Mm-hmm.
so big. And we have to evolve in that realm to look at how we are making space for kids to communicate and and valuing children's ability to talk to you clearly and communicate clearly and not receive that in a certain way. That is very important. I know it's a whole nother conversation, but it's intricately connected to what you are saying because that's the beginning of that stair step model to get to where we need to be in the Black maternal care community.
Mm-hmm.
Silencing starts early. We start training people early not to speak up. We start training them to sit in the corner early. And then it's look, and I'll share personally, it took me years. I was a kid just letting doctors continue to give me birth control, never giving me an ultrasound or anything. I didn't know what fibroids were, and I didn't know how to push the doctor. My mother asked questions, but nobody would answer. I didn't understand how to push the doctor. I know how to do it now, but I had to be grown carrying a baby and going to the doctor with stomach pains when I was about 4 months and I was scared of losing my baby. That's what made me put my foot down.
Mm-hmm.
We shouldn't have to be in crisis mode because suppose something happens before
Mm-hmm.
then that is life or death for you. So okay, and I'm done. That was
The truth, I would always tell my patients, be the squeaky wheel.
Mm-hmm.
Squeaky wheel, because that's sometimes that's the only response, and I even tell my family that, when my mother was having issues, and she was like, I go to the doctor and I did this and then they just give me this medicine and it still hurts. I said, well, then go back, because what they gave you didn't work. Go back. And when she went back after pushing, then it was like, okay, well, we will schedule you an ultrasound this time. And what did they find then? Cancer, right? That had spread everywhere by then. And I'm just like, if someone would have listened and paid attention, kept on saying, well, that didn't work. What could have been different? So be the squeaky wheel.
I also want to say that advocacy looks different for a lot of people, right? So for us on this phone, we're just going to speak up. We're the bold ones. We're the I know you didn't, and you go, and I'm the bang 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 on the glass. But everybody is not like that. So there are other forms, there are other things that you can do to advocate for yourself. If you don't like confrontation, at every clinic or hospital, there is a team that is ran by people like me that will take your grievances, that will take your complaints. If you feel like you don't want to get into that conversation with the physician, you don't want to get into the conversation like that with your PA or your nurse practitioner, it is okay. There are other avenues. That little card at the front office, don't think that people are not reading those cards. If you want to get online and do a Yelp review, do a Google review, if that's all you are comfortable doing, do that. Because we are looking at those reviews. We are auditing those physicians. We are holding those doctors accountable. And I assure you that even if you don't feel like us, there are still ways that you can advocate for yourself. Don't feel like that your voice is not going to be heard because you're not the one that's going to walk in the room, screaming and yelling at someone, because I am that one. But if you're not, please be encouraged. There are other ways that you can advocate for yourself. But please, I encourage you to do something. Just don't accept something that you know is not right for you, your maternal health, and for your children.
Baby. This was an amazing conversation tonight. Jamil, I'm just waiting on you. I'll start crying in a minute, so I'm gonna be quiet. I feel the emotions are real high tonight, real high. Okay.
Now, this is an excellent discussion. I think we've we come up with like 4 or 5 more panels after this discussion that we need to continue the discussion. Yeah, this is just, it feels like we've just opened Pandora's box, right? Because there's so many layers and components. I feel for us to be able to really continue to move the needle on Black maternal health. The best thing I feel that has come lately is that people are realizing it. They know the statistics.
Yeah.
We are discussing it, and before action can happen and before change can be implemented, we have to make sure that we're always discussing the issue. And so, no, yeah, this was great. And I think we've had our closing remarks. If you want to add anything else, Jamie, we do have our Black Maternal Health virtual walk on Saturday. And so for you guys that like to walk, we'd love for you to get out there, take pictures, put it on social media with the hashtag NELA Black Maternal Health.
Please.
We just want to make sure that, we continue to just make people aware, right?
Yes.
Because, I feel that the way that things are looking right now, that we're going to have to be louder.
Yeah, absolutely. Absolutely. Well, I just want to express how thankful we are for this amazing panel again tonight. You all were amazing. I mean, I didn't think the conversation could get any better than it was Monday. And then we have, tonight, and it was, I feel even more full. I think if I'm going to get the walk in to help calm me down, but we just might explode by next Thursday, So I want to thank you all so much for taking your time out tonight to join this conversation, to enlighten us, to share your stories, to share your resources, your philosophies and core beliefs. Most importantly, for being who you are every day, for working and being a living example of how we make humanity a better place. To those who are tuning in, we do have the maternal health walk coming up virtually. We're asking everyone that this message gets to, please, please, please help us make this a movement by taking a walk with us. On Saturday, you can walk around your block. I'm asking people to do a mile, but you can walk around your block. I'm going to go to ULM and hit the trail. I usually walk in my neighborhood, but I'm going to go to ULM that day. And I'm going to make sure to share my video on walking. Jamil will be sending her videos and pictures. And we're asking you to send us videos and pictures of you walking so we can make posts to let people know that we've created this movement, that you are breaking the silence on Black maternal health in NELA as well. We want to make a resounding noise for our community that says, we hear you, we are aware, and we are building conversations that we hope will transform the lives of women. And then next Thursday, of course, we'll have our in-person event. We have some amazing panelists lined up for that day, and we're very excited. We've been getting some amazing support from the community. So we hope that you all, if you have not registered to attend that event, it is free to attend, but we want to make sure that we have enough doodads for everybody that night. So please do your free registration ticket to attend. And we're just so thankful for everyone. And we thank you all for being here. We wish you a great rest of the week, and goodbye.
Bye. Thanks.
Good night.
Good night.